KUAM News Zoom room. We have the Vaccine Operations Chief. That's her COVID title. Annette Aguon of Public Health and Social Services. Annette, it's been a minute. We're so glad to have you this morning.
Yeah. Thanks for having me back.
First of all, guys, nobody's on fire. That is Annette Aguon's security system. And I know there was a public health oversight hearing that we were kind of joking about before we came on, where she was in there and it kept beeping, and you kept seeing all the senators like looking like, what is that? They were checking their smoke detector. I think we had even made a joke here on the show that you needed to change the battery for your smoke detector. But it's the security alarm system. But don't worry, you're not going to hear it after the first 20 times. You kind of get used to it. But Annette, I wanted to just, before we get into it, right, as we're fastly approaching the 1-year anniversary of COVID-19, what a ride it's been. I just want to get just a little bit, if we could, your thoughts on looking back at the past year.
Yes, we've been commenting among ourselves that this is the longest outbreak pandemic response we've dealt with. We've been through H1N1, measles, and pertussis. But yes, it's been a difficult road, but Guam and our people, we persevere. We are strong, government good. And so we have been very cooperative as compared to some counterparts in the mainland. And so yes, we've had some surges and a huge spike, last year, but our people have been very responsible, and helping us to, flatten that curve, and now we're pushing to increase vaccination. So again, it's just been very challenging, but also rewarding to see that we've pulled together as always, and that we're taking care of one another and trying to get ourselves back up, and pushing forward and looking ahead to better days.
That's it. 3 sentences. At any point,
nice.
and at any point this pandemic, I mean, because one thing I think about as I look back on the last year, I really think that people in my circle, my family, my members were very fortunate and blessed. I mean, my son caught COVID. My 17-year-old boy, he had it pretty bad for a few days. But other than that, like a lot of people in my circle, we were able to escape this pandemic without catching the virus. So that's something that I'm really grateful and happy about. But, when I look back at the past year, it's just been like every kind of emotion that you can imagine all bundled up into, I mean, there was like, Bree, in the beginning, right? There was the anxiety, the fear,
worry,
everything. Right? And now there's like that acceptance. I want to see that, what's that 7 stages of grief chart? I wonder how much of that is, because it was like collectively grieving together. But anyway, I know this ain't therapy, Annette. You're probably like, got 20 million things to do, Chris. So you're the Vaccine Operations Chief, and I know that you're stationed over there at the University of Guam. Pod, just generally speaking, if you want to just kind of talk about how we've been able to really like make the pivot from the rough spots that we saw when we first stood up the vaccination effort to now it pretty much seems like it's smooth sailing.
Yes, I mean, a new virus, new response, new vaccines that we're pushing out to the community, that we're providing, that our medical providers have also had to get caught up real quickly. These vaccines are coming at a fast pace. New technology used for the mRNA vaccine, for example, and now we have Johnson & Johnson, limited supply, but we have more vaccines on the horizon. But yes, it's definitely something that we always want to learn and improve, make things, as smooth and efficient as possible. The overwhelming numbers that we had, especially with our Manumco 75 and older, that was a great response. And yes, we've learned from that. We've opened up additional sites. Now we've even done smaller ones at the village level. We've added on homebound, and we've increased the number of vaccine opportunities throughout our island. When we first started, it was only public health and the 2 hospitals. Then we added on HSP clinic for their homebound. January, we added in like a few more providers, like 9. And then in February, we had again additional and we've onboarded some pharmacies. Now we have dialysis centers. So we've gone from 3 vaccination providers to this month. We are looking at now additional providers coming on board to make it 31 providers, be it multi-specialty clinic, a single provider, dialysis centers, even to pharmacies. And so we've also had more vaccinators come out. We've had dentists volunteer, pharmacists volunteer. So again, it just shows that the magnitude of this campaign, that we need all hands on deck. And again, it's an island-wide effort. Public health can't do it alone. The medical providers can't do it alone. We've had GPD, DPW, Public Works, the Guard has stepped up. Our mayor's office has stepped up. Now we're working with the various nonprofit organizations. We've had providers conduct their own outreach for targeted individuals, be it homebound, or at the village level as well, just so that we can continue to offer this vaccine out and provide more opportunities so that people don't have to worry about, only one side and there's a long line. So again, it's something that as we get more vaccines on board, we are definitely trying to increase the opportunities for our residents so that they can avail of this vaccine. And, going back to what you were mentioning earlier, Chris, it really is about hope now. There's hope for that light at the end of the tunnel, because there's something to prevent hospitalization, decrease your the severity of should you be exposed to COVID and you didn't get fully vaccinated. And so that's something, again, we do not want a repeat of what happened last fall. That took us all the way right to the holidays with that huge surge. So again, we thank everyone. Media is a part of it too, always out there and pushing the message for us, highlighting the vaccination clinics, who's been vaccinated, the stories that you guys have been pushing out for us to let people know, look, this my uncle's getting it. They're fine. It's safe. Now they can go spend time with their family, go travel to see grandkids that they haven't gotten to see, right? Stuff like that. And so those are some of the things that we appreciate you guys pushing out the positive side. And, with this ongoing effort, yes, it's been a year, it's long, and we're still not done. We have months to go.
What is public health's response, though, to this pastoral message that was issued by the Archdiocese of Agana yesterday with regard to the Johnson and Johnson vaccine not being morally accepted, and the call for the Archbishop to give people, a choice? And maybe we are given a choice, but
yes, I there's always the concern, and this is not specific only to COVID vaccine. This is something that childhood and adult immunizations, the concern of anti-vaccination, there's vaccine hesitancy, vaccine safety. However, with any vaccine, again, it is put through the testing process, it's evaluated and monitored, it gets the CDC stamp of approval, not just FDA, but CDC. And so that's what we always wait for. I know there's people who are hesitant to get a certain brand, be it because of the contents of it. There's other individuals who don't want 2 doses, they want 1 dose. And so again, if we could have all the vaccine doses available for the different brands and have preference, it would be great. Again, that's the right of the individual. We're not forcing this on anyone. It's not required for anyone at this point in time. However, we do want people to get fully educated and see the advantages, the benefits of being vaccinated. Because what if your loved one can't receive the vaccine due to they're too young, they're below 16? What if they have medical conditions that contraindicates them from receiving this vaccine? We want you to protect those who can't get the vaccine. And so again, to really go to do the research, valid information, valid sites, and get educated and avail of the different vaccines that are out there for you. We are definitely not pushing one brand onto you, but there are options out there for you.
So when public health, the VAPC, they authorize the prioritization of the Johnson and Johnson vaccine, because that's the one that the church is concerned about. They authorize the prioritization for this particular single dose shot to be administered to homeless, homebound, and the senior citizens that are registered with the adult daycare centers. So how is that going to work? Are people that are in that particular group, are they going to be what if they don't want the Johnson and Johnson vaccine and they want Moderna or they want Pfizer? Are they going to be given that choice?
Yes, we will work with them as much as possible. We do try to bring more than one vaccine brand. The challenge with Johnson and Johnson is it's only 1,300 doses.
Yeah.
And I mean, we actually have other people calling in and requesting for it, and we're really trying to also focus on, will we be able to see you again and to get that second dose to complete you for Moderna or Pfizer? Because again, we want you to have the full protection available for whatever vaccine brand you choose to get. So yes, if you are hesitant to get Johnson and Johnson and we have more vaccines coming in and making it available, then we'll make that effort. We may not be able to vaccinate you that day, but we'll definitely keep your information and have to either make arrangements for you to go to a different facility or see if we're coming back for a second round and offer you at that time.
We had a question here, Annette. When can people who have had COVID get vaccinated? The website, I guess, I don't know if it's CDC or yours, states a person can defer getting vaccinated for 90 days if desired, since reinfection is uncommon. This woman messages me, one clinic pharmacist told me I have to wait 90 days.
Yes, it's recommended 90 days from your exposure due to circulating antibodies. You already have some level of protection in your system. And so due to limited vaccines, we want to afford it to someone who didn't have exposure and, can start to build up immunity. However, it is not a contraindication. So should an individual want to receive the vaccine less than 90 days from recovering from the actual disease, you can still go ahead and give it. It's just we're asking people to work with us because of the limited supply that we have, and that after your 90 days, definitely come back and get the vaccine. But again, if you don't want to wait the 90 days, by all means, it's still okay for you to get the vaccine.
Do you have an update on the vaccines that were administered to the prison population?
We just approved that, ma'am, and so we're coordinating with the GMH, who has nurses contracted there to oversee the inmates' health, and so we're working with them to coordinate the vaccination.
Okay, and it's all of them.
It'll be offered to the detainees and inmates, and again, we're not requiring it, but it's highly recommended because of their congregate setting makes them at high risk.
A lot of inmates.
Yeah. Let's go and bring Janela on to Janela Carrera, of course, public health PIO. Annette, in closing, I want to ask, what are the biggest impediments to reaching that herd immunity by July 21st from what you're seeing going out there and being on the front line with the vaccination effort?
Vaccine availability, the number of doses that we are given on a monthly basis. We saw what happened, last month where we didn't make it through February because the demand is so high, which is great. We don't want to lose that momentum. People here on Guam know the importance of vaccination and protecting themselves, their family and friends and loved ones, and so we want to continue that momentum and have the vaccines available so people don't lose interest and say, you know what, I'm waiting so long, what's the point? So our leadership, from our director to the government, has been constantly requesting from the federal government more vaccines, and by all of the providers pulling together, showing that, we're burning through the vaccines quickly. We're administering it. We need more. That just has shown over the past few months where we've increased. We had less than 20. We had 17,000 when we first started in December. Then it went to 19,000, 20. So now we're at 35,000 for March. So we're hoping for more vaccines come April, and so that we can continue to increase the number of individuals we immunize in a shorter time frame. And so that's something too that the VAPPC discusses. Let's look at dropping the age groups faster. So we've been giving people 3 weeks opportunity as we went from 75, then we dropped it down to 70, down to 65. And so moving forward, because we're getting more vaccines, we're using it quickly, we want to bring in more people so that we can increase the immunization rate to get to that herd immunity, before or by the July target date. And so again, we need the vaccines, and we will work with all our partners to get it out there and put it to people's arms. And then we're just waiting for future guidance from FDA and CDC to drop that age group down, because again, we cannot give anyone below 16 at this time. Moderna and Johnson & Johnson, you have to be 18 and older. So again, we're working to immunize this older population, while we protect the younger generation until we can give the vaccines to them once it's been approved and licensed for that age group.
Are you seeing people that may have gotten the first dose of the vaccine and then just saying, I don't want to go back and get the second dose?
We've heard some people have some concerns. Other people are like, you know what, I didn't feel anything.
Mm-hmm.
And they're when can I get the second? We've had people coming in too early for the second one because they want to be completed. So again, we want to follow the recommendations and the guidelines, because if we give you too early, we don't want to have any issues. So there have been some issues. Again, please talk to your primary doctor, and so we can allay any fears. And again, there's some people who may not be able to get that second dose because you had an allergic reaction to it, as in with any medication or vaccine. So again, even if you had the first dose and you come back for the second dose, you will be screened to make sure it's okay for you to get the second dose. And unfortunately, there are some people who, you had a reaction, and for your health and safety, it's best you do not get the second dose. And so we do that for every individual, because again, we do not want to do any harm with this vaccine.
How many cases have you had of that where someone's reaction to the first shot was so bad that you said, oh, no second shot for you?
Well, we've been fortunate that we've only had maybe like a handful, and then some of it through further investigation, or they went to the medical doctor, to the hospital, it ended up being something else that they had issue with. And it was just the timing of the vaccine. So we've had 2 or 3 who've, unfortunately, yes, it's an allergic reaction to the vaccine. But 1 or 2 of them, they still want to get it because they see the importance of the vaccine. And so this would be that rare instance where you can't get this Pfizer or Moderna because you had an allergic reaction to dose 1. In this rare instance, we can give you Johnson & Johnson. Mm-hmm. Because you still want the vaccine, but we don't want you to have any complications from it.
With Johnson & Johnson, because it's still fairly new, is it kind of the same for side effects? And also, when before you could get Pfizer and Moderna, you guys were pushing out that you can't have COVID 2 weeks before. You can't have taken a vaccine 2 weeks before. Is it the same thing with Johnson & Johnson?
Yes. All the precautions still have to be there. Yes, ma'am.
Side effects also still the same?
Yes, same expected side effects. And unfortunately, over the past few months, we've been seeing the younger the individual, the more side effects you may have. So like for those older than 55, they've been getting minimal side effects. And then more recently, I just read it last week about women have more side effects than men. And so again, as we learn more, as we go along, the research is being there, information is still being collected about vaccine safety, vaccine side effects. And so again, as this information is gathered, CDC is pushing out to us. There's even that concern about the timing of women getting a mammogram and getting the vaccine. That's something that just came out too, like last week. So for women, by all means, get that annual mammogram. It's very important. But ideally, we want you to get it before you get your vaccine, because they've seen some instances where the women got the vaccine, then they went to the mammogram and there was something questionable on there. And then they thought, oh, that's a possible side effect from the vaccine, that it causes swelling. And so, to reduce anxiety for women, please get your mammogram first before you get vaccine, or wait a month or 2 if you got vaccinated first to get your mammogram, just so that there's no misinterpretation on your mammogram results.
So you're saying that women experience more adverse side effects from the vaccines than men do?
That's what they're saying, yes.
It's got to be, it's because of your increased intelligence, right?
Yes.
Yes. Thank you, Sabrina.
There's a clinic, FSM outreach clinic. How are the numbers with the FSM community getting vaccinated?
Our brothers and sisters in the FSM, FAS population is not as high as we would like it to be. And so that's something that Janela has been working with internally, but also with external partners to really get the word out. How can we adjust our strategies to educate them better, or what are some of their concerns, so we can answer that for them and encourage them to come in, reduce that vaccine hesitancy. And again, it's to be culturally sensitive to any group here on the island. And, that's something that we do across the board for any public health effort. And so Janela's, been working on that, and how can we go and go out to reach them, and increase their immunization rates for their community.
Yeah, and so actually GRMC is having a vaccination clinic today from 2 to 5 p.m. And this is primarily for those who are due for their second dose when they had that vaccination clinic last month. But when they had that vaccination clinic last month at GRMC, it was largely successful. And that's because they worked with stakeholders within the FSM organization. And they went out, they engaged the community, they registered a lot of people. And so of the 149 people who were vaccinated that day, over 100 of them were within the FSM FAS community. So it shows that when you engage the community, have people from within their community involved in this effort, it really shows that you can be successful. We want a repeat of that project. And so we're trying to continue that partnership and ensure that they're involved in any project that we do within the FSM population. So for future projects, like for example, rapid engagement team mobilizations, we're going to ensure that members from within the FAS, FSM community are part of the process. We're also working with AMC, GRMC, and we've actually been meeting constantly for the last few weeks with individuals within the FSM Association, FSM Consulate Office. So, this is an ongoing project, and this is not something that's just tied to vaccination and testing. We want to continue this effort even beyond vaccination and testing. We want this to be something that's going to go beyond COVID-19. So I think this is a project that's going to benefit very many people within the FAS and FSM community.
I think this is the first week that we hadn't heard about a community testing.
Yes, you're right. You're right. We resumed homebound and village-based vaccination because we did receive our vaccines. So we wanted to really focus on that. But we are going to be resuming COVID-19 testing and possibly trying to do this 2 to 3 times a week. So this is a really huge effort, and we're looking to resume next week. The details haven't been finalized, but we are working on a plan, and whether it's going to be 1 or 2 locations, but we do want to do something where it's 2 to 3 locations every week, offering it to all the people of Guam. So we'll hopefully be announcing that either today or very, very soon, where we're offering COVID-19 testing 2 to 3 times a week, every week.
Is there any update on the ISOFAC facility moving out of Bayview and into a smaller facility?
So we're hoping to get that, the ball rolling on that pretty soon. I think it's really just a matter, in terms of getting the contract out. But again, it's still being discussed and, a matter of just moving things forward. But that's still, I know the last time I spoke with you guys, I said it was a discussion, but I think we're moving a lot closer toward making that happen. But at this point, I really don't know exactly at what point we're at now. But that is still the goal, is to get us out of Bayview and hoping to get us into a different location, whether that's at Dusit or somewhere else.
Did you have any update on any DEH investigations that were conducted since the last time we had you on?
I should have a report, because we do want to start moving forward, have a weekly report out. But I know that our investigators, our inspectors have been going out regularly to restaurants and bars, visiting them, whether it's, I don't know if it's a nightly type of thing, but regularly. And I know that some citations have been issued, but today is Friday. Unfortunately, as you know, our email server is down. So we haven't been able to get them through our regular email avenues. So I'm going to see if there's a different way that we can get that to you. I know WhatsApp has been, one way to do that, but I'm going to see if I can get that to you guys today. But we did compile a report, so I will try to get that to you guys.
Thank you.
Are we still on track for resuming first dose administration of the vaccines? Is it next week? Next week?
Yes, next
Yes.
week. Okay. Next week. We did. I know that I don't know if Annette had already mentioned this because I came on a little late, but the VAPPC did approve lowering the age threshold to 50 starting next week,
Okay.
or officially took that action.
Okay.
All right. That's it. Anything in closing, Annette, before we let you go? Or did I already ask you that? How about second
Yeah,
closing?
Second closing out. Thank you again for helping us push out the word. Again, we thank everyone for their patience. We focused on dose 2 this week, but yes, moving forward, we will be offering out to dose 1, and we will be dropping the age group, at a much quicker pace than we did in the past. And so again, we ask for people's patience, but we will, again, as we get more vaccines, we will definitely increase. And thank you everyone for the support. We could not do this without, everyone's support, and for our residents, patience and understanding, and the desire to be vaccinated. But again, still practice those W's, right, of washing your hands, wearing your face mask, and your distance, even if you're vaccinated. And so we can continue to keep our curve flat moving forward. So thank you very much.
Well, thank you, Annette. Janela.
So nice to see you again,
Yeah.
Annette. Yeah.
Good to see you guys too. Thank you.
Right on.
Janela, we asked Annette at the beginning of the interview about it. It's going to be 1 year since this whole pandemic really started. And I guess for you, reflecting back, what has been some of the lessons learned for you, or anything you'd like to say as you look back at 1 year?
Sure. Actually, a year ago, I was still at the governor's office when this happened, and I still remember it because when Governor Leon Guerrero had to make that painful announcement, we were at the Office of Homeland Security, Civil Defense, and I think just a week before, or maybe a couple of weeks before, she had to do her State of the Island address, where at the time she was able to state that COVID-19 had not yet hit our shores.
Right.
And just a week or two later, we had to make that announcement that it did. And now a year later, God, so much has happened since. Lots of lessons learned, you're right. Many of them painful. And earlier I was listening to you, lots of emotions, different emotions, many of them painful. So many lives lost. Many people have been sick. But we've I think as an island, we've gotten through so much, and I think one of the lessons that we've learned through all of this is that we're still so much resilient. And as a people, one thing that I appreciate throughout all of this is that despite all of the rhetoric and the negative comments, which can be really ugly at times, there's a community in all of us that we all come together. So I do really appreciate all of that. And being in the public sector, and working with people like Annette, Director Art St. Augustine, and all of the government employees who've been behind the scenes and trying really hard to save lives. All the nurses, the EMTs. I think what you don't see behind the scenes is that we really do the work that we do really is to benefit the people of Guam. It really is, to try and save as many lives as possible. So, we don't see it as much, we don't say it as much, but we know it in our hearts that what we want to do is really good, is for the good of the people. So just wanted to put that out there.
All right. Well, thank you for everything you've done. You've been very accessible throughout this whole pandemic, and we really appreciate you and your help in lining up some of these interviews, especially like with Annette and
Dr. Pobletsky.
Yeah.
She's my favorite. I mean, Annette, I love you too, but I like Dr. Pobletsky because she don't like cut around. She's like, it's not over.
Sorry.
It's never over. It's a pandemic. They last for years. I didn't like that. I like, it's like she's
Great.
salt, you're sugar.
She's great.
Yeah. All right. Thanks, guys.
Oh, Lord.
Of course, anytime.
Thank you, Janela.
Thank you. Take
God,
care.
God bless you, and thank you guys for your service.
God bless too.
Right on.
Thanks. Take care.